You may have heard about convalescent plasma as a way to treat coronavirus patients, but what exactly is it? I spoke with the Senior Executive Director of Recruitment and Marketing at the New York Blood Center, Andrea Cefarelli, about the blood bank's role in plasma collection. Cefarelli explained convalescent plasma comes from recovered COVID-19 patients.
It's a sort of special plasma because it comes from a patient that has convalesced or, recovered from COVID-19. And so their body has the antibodies, which are proving very beneficial to people who are fighting COVID-19.
NYBC has been working to supply the New York metropolitan area with plasma to help hospitals treat severe coronavirus cases.
New York Blood Center is, so far I think in the U.S., the largest provider of convalescent plasma. We're very proud that we just worked really hard over the early weeks of the pandemic. We thought that this would be a valuable product, and first it was used primarily in New York, where we were kind of the epicenter. And then as cases around here dropped, we've been tremendously proud that we've had enough convalescent plasma to be sending it to Texas and Florida.
Doctors use the plasma to treat patients through transfusions.
There's lots of studies going on, but in general, it appears that 2 transfusions, maybe 1 or 2 days apart, so 2 units of convalescent plasma seems to be the kind of magic right now. So a patient that is quite ill would get 2 transfusions.
To give convalescent plasma, potential donors must have come into contact with the virus in some way.
You have to either have a positive COVID test, so you could have been asymptomatic but happened to go for a test and it says, yes, you had COVID, and you must be 14 days minimum symptom-free, or you can have a positive antibody test, and you have to upload one of those 2 documents to us, and then you just make your plasma appointment, primarily at one of our 19 donor centers.
Donors can donate up to 8 times in 3 months. The New York Blood Center has also been dealing with a shortage of blood and donors amidst the pandemic.
Blood donations, all the places that people typically gave blood, are really not operating like normal. So it's a whole new world for, making it convenient for people to give blood, and we're figuring it out every day.
Now, NYBC wants to make sure there is enough of a supply to help patients if there's a spike in cases in the fall.
We're ramping up again, one, because we think we should have a second inventory store heading into the fall and back to school, and in case we get a second wave, but also we didn't anticipate the national need, and so we really want to make sure that we have product for any hospital or other blood center that needs it.
Thank you again to Andrea Cefarelli for speaking with me. If you're interested in donating whole blood or plasma, head to nybloodcenter.org for more information and to find a donation center close to you. Reporting for WRHU, I'm Cait O'Brien.